Alright, team, listen up. The patient presents with three symptoms: calcific tendinitis, synovitis, and laryngitis.
Those symptoms could point to a few different diagnoses. It's quite a complex case.
I'm leaning towards a rheumatologic condition, maybe something like rheumatoid arthritis.
I'm thinking more along the lines of an inflammatory condition, possibly lupus.
You're all wrong. It's congenital ichthyosiform erythroderma.
Congenital ichthyosiform erythroderma? Are you sure, Hawks? That's a rare genetic skin disease.
But how can we be certain without further tests?
Trust me on this. We need to perform a quadrantectomy immediately.
Quadrantectomy? That's a risky procedure, folks. Are you sure it's necessary?
Damn it, Frank. I didn't spend years studying medicine to have my decisions questioned. We need to act fast before it's too late. Get ready for surgery, team. Tracy, thanks for calling me in. I want to discuss performing a quadrantectomy on my patient with congenital ichthyosiform erythroderma.
Hawks, I appreciate your expertise, but I need to understand why you believe this procedure is necessary.
Necessary. Tracy, I've been practicing for over 15 years. I know what I'm doing.
I understand, Hawks, but we have to ensure we're making the right decision for the patient's well-being.
Are you seriously questioning my judgment after all these years?
Oh no, this is not good. The patient is in critical condition.
How am I going to break it to Hawks that the quadrantectomy was not the correct treatment for congenital ichthyosiform erythroderma?
What the hell were you thinking? You nearly killed our patient with your incompetence. Wrong quadrantectomy, wrong diagnosis. Are you all even qualified to be diagnosticians?
I still think it's a case of malignant neoplasm in the left lateral quadrant.
No, I'm pretty sure it's a benign tumor in the right medial quadrant.
Actually, I believe it's an infection in the left medial quadrant.
You're all a bunch of imbeciles. How did you even make it through medical school?
You're a disgrace to this profession.
But Dr. Hawks, we can...
I don't want to hear it. You're all a danger to your patients. I'll find the right diagnosis myself. I can't stand to be in the same room as you fools any longer. Storms out of the room. I can't believe I still haven't figured out what's wrong with the patient in room 302.
Maybe you should try looking into the symptoms again. It could be something simple that you overlooked.
I've already checked all the symptoms multiple times. I just can't seem to pinpoint it.
Well, have you considered the possibility of a rare condition? Sometimes we have to think outside the box.
You might be onto something there, Johnson. Thanks for the tip.
Anytime, Hawks. Let me know if you need help figuring it out.
Suddenly sits up. Wait a minute.
Confused wait? You're leaving? What about finishing lunch together?
To walking away, I'll catch up with you later. Thanks for the help. I need everyone's attention. Forget about congenital ichthyosiform erythroderma. It's wrong.
This patient has giant platelet disorder.
What, Hawks? You can't just barge in here and make wild diagnoses without proper evidence or consultation.
Yeah, this is a serious operation, Hawks. We can't afford to make mistakes based on hunches.
I have to agree with Gary and Kelly, Hawks.
This is not how we operate in the operating room.
Trust me on this one, guys. I've seen the signs. Let's prepare to treat giant platelet disorder. We don't have time to waste. Tracy, I finally found the right diagnosis for the patient.
That's great news, Hawks. I'm glad we got there in the end.
If you had listened to me from the beginning, we could have avoided this whole mess.
Hawks, the wrong diagnosis nearly cost the patient their life. You should have trusted my judgment.
Trusted your judgment? You nearly killed the patient with that wrong diagnosis.
And yours did the same by not considering all possibilities.
This isn't about egos, Tracy. It's about doing what's best for the patient.
Well, maybe we both need to learn to listen to each other better.